So, oh yeah, now I can see you. So I'm just going to share my screen and show you the agenda. Welcome everybody to our dispatcher meeting. So we didn't have a meeting last week. So the agenda looks very long, but actually most of the points are going to be just 1 minute. So it shouldn't be too long. There's nothing particularly, you know, jumping at first. So we're going to go quickly through it. Let me share my screen. Share screen. Share screen. And this is the agenda for tonight. So we're going to be looking at safety in shops and safety of our volunteer. And Mary is going to do us a reminder about the protocols and PPE, etc., for our volunteers. Then we're going to have an initiative starting with Mary and Colleen about a sewing group. Then Dom might just give us an update on PPE, Bruni about the letter to resident that has been distributed. Jenny, I sent an apology, so I'm going to cover for her and just quickly go through the website, the new website that you've all seen, hopefully, and also open up a discussion about the Facebook group and page. Then give you an update about the parish council collaboration, in particular about Westfield. And then Anthony will give an update on vulnerable people, and then a little bit of a discussion about why tracking is important. So I think there's been some confusion about why is it that we're doing the tracking, so just to have a kind of a clarification on that. And then finally, other ideas for RMA. We're calling them mini projects, we were talking earlier, so a little project that we might want to be involved in. I'm going to stop sharing my screen now, and I'm going to hand over to Mary.
Oh, am I on first? Okay. Hello, everyone. Safety in shops, and we've had this protocol for quite a while now, and it seems that a lot of dispatchers who do a bit of volunteering and also volunteers are sticking with the protocol and wearing masks, gloves, some wearing eye shields into shops and in confined spaces like the chemist, and some aren't, we hear. So basically I think it's very difficult. We can't really enforce anything, but all we can do is hammer home the importance of it and why we're doing this work. And the whole point of this work, the whole point of RMA, is to help support the vulnerable and shielding residents in the town and districts. And really the only way we can effectively do that is if we don't put them at risk. And really the only helpful thing that we can do is to wear our PPE when we go shopping and to use good, clean techniques and try not to interact with them too much and ensure that they wipe down their shopping as much as possible. So I think I'd like to hear from some of you, if possible, rather than me just droning on, because I think most of you are all only too aware what the issues are, where you think there are breaches, what evidence you have. This isn't a police exercise, but it would be helpful to know, you know, roughly what percentage of the volunteers you think are actually following protocols and how many aren't. If you've had discussions with them and how you approach that and how they've responded. So any feedback from any of the zones would be grateful at this point. Just chip in.
Dominic, should we unmute everyone then, in case people want to just share their experience of that? Anybody wanted to share what's happening in their zone regarding that, or how you're ensuring that your volunteers are following the protocols and wearing PPE, etc.?
And a resounding silence. So maybe it's working.
Hi, I'll say something.
Okay, so no questions from anybody?
No,
Yeah,
Lois,
Lois said she wanted
I'll just make a comment, which is I think we've provided the equipment, it's quite difficult to enforce to wear masks when the governmental guidelines and other scientific stuff keeps getting shown is they're mixed. So I do think that's quite difficult to enforce, and I think our approach has been to say that this is the protocol, and then people must use their common sense really about whether they're going into an enclosed space and whether there's a risk.
Mary, did you want to come back on that?
Yeah, I think the common sense thing doesn't really apply, actually. Respectfully, this is a new virus. It's jumped across from mammals, and we don't know much about it. So for people to be voluntarily, I think, making decisions about what they think is good common sense or not, is perhaps not the most helpful thing, if I could put it that way. I'm with Lois in that there is considerable scientific debate at the moment, but really every single link I have shown and shared is sound, and it's beyond doubt that if you cough or sneeze or even have something called a forced expiration, so if you're jogging or you make an exclamation in front of someone's face, so you go, I just don't agree with that. The amount of spittle, frankly, and aerosol that you exude from your mouth is immense. There are lots of photographs and videos of this online, and I'm not going to keep sharing it and sharing it and sharing it. The links are there. We've shared them, and I think it's more about people not really wanting to do it, I suspect. Culturally, we don't have a big cultural heritage of wearing masks. They do in East Asia. They have done for maybe 20 odd years now, and certainly since SARS and MERS, they've done it a lot. So it's the common thing in Asia, if you have a cold, to wear a mask to protect others from your spittle and aerosol, frankly. But in this country, we don't have such a culture. And yes, there is a debate in science about it, but a lot of the anti-mask wearing debate is supported, how can I put this, by political forces that are worried that we are going to undermine PPE available to the NHS. And I really don't see how that's at all possible if you're wearing a cloth mask, because they've not been, you know, they're not the sort of masks that would be available. So all we can do, I'm afraid, is continue to encourage, and slowly it will come. It will take a while, but I think that's all we can do. We can't enforce things. If people don't, I think we could go back to saying that if you don't want to abide by protocols and you're visiting vulnerable people on cancer treatment, maybe you want to hand over to someone who does want to follow protocols.
Can I follow on that, Mary?
Yes.
Can I quickly follow on that? And also, I suppose I agree very much. There are some lovely comments in the chat, and I agree that it's important that there, you know, we use positive reinforcement, and when Mary's going to talk now on the next initiative, it will be about positive reinforcement, definitely. But on the other hand as well, when people joined us, they did sign the acceptance of liability, and that meant, and that said, that they were going to follow protocols. And the protocols are quite clear right from the start, that if you are to enter an enclosed space, it being a shop, it being the pharmacy, you have to wear a mask. So maybe it's then for the dispatcher to then use their judgment in the sense that they would then know who is actually okay with that. So it's better if you just use 2 or 3 volunteers, if you think that they only 2 or 3 who use masks, because that will cut the transmission. So yes, I know we can't enforce it, and it's not what we are. We're not there to check people and police. That's not the idea. But we have set up some protocols. We are trying our very best to not be a vector in our community, and that will mean follow up on Mary's advice. And then, yeah, Mary, if you want to then move on to mask and just say the idea about the 40% of cut and the mask production with the sewing initiative, that would be lovely.
Okay. Just to say, just a couple of things. I know there's discussion in press and people will have their own opinions. They have their own opinions on why we're not counting, or we are counting deaths in a certain way. You could carry on like this ad infinitum. But the First Minister in Scotland made a cautious recommendation today, I think, for wearing masks on public transport and in enclosed areas and shopping. So I think it is likely that this will come here too. It's just a question of just slowly catch you monkey and constantly harping on about the protocols. I am happy to say that there is evidence that you can cut cold and flu and SARS transmission between 30 and 40% if 75% of the community who are in contact with each other are wearing masks. And that scoops up the asymptomatic carriers and those who are, as we call it, pre-symptomatic. So if you think of the fact that we're doing this social distancing to cut transmission, when we slowly lift lockdown and perhaps increase some aspects of our social interaction, whether we wish to or not, the sensible thing to do if there are more people around would be to wear a mask. I can't really put it any plainer than that. It's good to see on the chat, I'm just trying to review it as I speak, that Jempson's and the chemist are wearing masks. Jempson's long overdue, and lots of praise for them in doing that. Sweet Williams have been wearing masks and are continuing to do so, and you know, it will slowly catch on. And because we're all in this sort of quasi-lockdown at the moment, the critical time is yet to come when some of us are released and we have more social interaction. So we've got time to press the advantage home. Okay, on the sewing initiative, a number of us have decided that just having people gallantly at home making masks without any contact with us is lovely, but we can't really increase production, and our aim is to get them for every single volunteer in Rye and Rye district, and as many residents who need them, who don't want to wear fancy ones that have been bought from the internet. You know, I dare say we're not catering for the young trendsetter in Rye with most of our masks, I have to admit. But the idea is to increase mask production so that we have a small stockpile ready for when social interaction increases. Those that need them can have them, those that want them can have them. And we just need to continue to really increase production. So we've set up this small sewing subgroup. We can call it a mask hub, a sewing group, whatever we like really. And the idea is to identify in each of our zones as many as possible of sewers preferably with sewing machines, because doing these by hand is pretty slow, who are prepared to churn these out. At the moment, we have about maybe 10 or so individuals that we have contact details for, and there's probably another 10 to 15 individuals who are regularly putting masks in the polystyrene box at 12 Eagle Road, but I don't know who they are. So we've set up this mask hub so that we can be a little bit more organised, so that we can identify who our sewers are, and we can try and roll those out a bit more in the zones, rather than just having them all at one central area. But to do that, we've got to do a little bit of work first. Yes, the pattern is on the website. And how are we planning to distribute masks to residents? Good question. We haven't got the numbers yet, so I don't think that's something we need to address this evening, but it is something I've thought about. Yes, there's a video on how to do the masks. There's at least 3 articles on why masks are a good idea.
I think that's a good introduction to the masks initiative, and hopefully Colleen will then contact people on Facebook and everywhere and collate all those numbers, and then we can come out with the full description of the club. Yeah.
Yeah. A few Rye residents and RMA supporters have been in touch with me and others about making scrubs for the NHS. I've spent quite some time trying to identify if there's a need. There is a local scrubs group in Hastings. There are scrubs groups covering Brighton and Hove, Eastbourne and Canterbury and Ashford, William Harvey Ashford. If anyone really wants that information, it would be sensible to contact me at the moment, but we'll probably put that on a blog on the website, I would imagine, at some point, because we have a group locally called RX Scrubs. Now, I've been in contact with them to see if any Rye sewers want to liaise with them and ramp up scrubs in the community if they get bored with making masks. And unfortunately, they haven't been back to me. Now, that either means they haven't received it or they've got enough sewers, because I offered them sewers as opposed to anything else. They're quite a well-funded group. I think when I last looked, they got just under £12,000 for Conquest and St Michael's Hospice, so maybe they're okay.
Okay, perfect. I think, Mary, we've got 10 minutes left of the meeting, so I think...
Okay, I'm going to shut up then. Right, fine.
Sorry, don't mean to be sorry.
I don't care.
So yeah, we will share more information via the dispatches update email and on our page and on Facebook and everywhere regarding the mask initiative. But if we follow what Mary said, and we can actually cut down the transmission in Rye by 30 or 40%, it could actually save lives. So we really want to push for that mask making club, team, whatever. So the next one on the agenda was PP. Dom, is there anything special you want to say?
Just very briefly, I've still got lots of badges. We've got other things other than the mask. So gloves, we've now got washing up gloves, marigolds. They're more durable than the latex ones we've got. So if you want any of those, just let me know. As always, if you want to get stuff from me, let me know the quantities as well. Otherwise I have to come back to you and say, what are the quantities? Because I need to bag stuff up and leave it outside my door. So that's just the process. But please get in touch. Don't hesitate. We've got lots of stuff right now. So it's important that all the volunteers get what they need. Thank you.
Thank you very much, Tom. Letter to resident Bruni, did you want to give any update? Bruni?
Sorry, I was on mute. Yep, thank you everybody for doing all your letters. I sent an email out to dispatchers last night, so it'd be really great to get some feedback from you all. Just let me know how it went, how it was received. If you've got any spares, can you get them back to Dom? Or if you've got neighbouring villages or zones, just check in with them to see if they need any extras. Yeah, but I've had some feedback from people, mostly positive, but if you've got any comments, it'd be really great to hear them. Thank you.
And I'm afraid I'm always the bad cop, am I not? Just on that point, there was some feedback coming that some of the people that were distributing the letters were actually not RMA volunteer, but family members of RMA volunteers. And we just wanted to reinforce again the fact that although, you know, it's really easy, you know, to just kind of say to your husband, your son, please give me a hand on that. We would prefer if you could just really encourage your volunteer to then encourage their family members to become volunteers. So we've got that kind of idea that yes, they've read the protocol, yes, they're aware of our safety protocol, and they're going to follow them. And it's just that extra layer of safety really to make sure that people are following protocols. So next one on the agenda was actually the new website, so that's a positive one. I'm sure you've all seen the new website. I'm just going to give you a literally 2 minutes tour of it for the people who haven't had the chance to have a look. I'm just going to share that one. Can you see it? Yeah, no, can you see it? Yes, cool.
Yes, indeed.
So obviously, oh, I'm probably better put you small there. So that's the web, the home page. The whole idea about changing the website was that we felt that at this point we wanted to use it as information center. Now that we've gathered enough volunteers, plenty enough volunteers, we're more being used for information. So we put what's the most important is your contact detail on the home page. And then everything to do with RMA, who we are, and how we work, and how to become a volunteer, and our protocols, everything is under that tab. So it's all nicely put there. So it's simple to find. And then you've got access to the dispatchers meeting with the password that has been shared. Then there's information about shopping. What we've tried to do is follow the order that we've kind of been using, which is, you know, shopping, then medication, then friendly chats, and then anything else, and use that for the structure of our website. You've got the local offers. We already had that. You had all the information about shop safely on this page. And you've got all the steps that we've basically taken out of our own protocol and adapted for residents. And added all the videos from Mary under. Identically, things that are a bit new that we didn't have. We had information about COVID and how to stay safe. We've got maybe a bit more information about PPE and the 3 key aspects of our PPE, which is the masks with a video from Jane, the gloves, and then the goggles. And also what we've done is we've gathered the information on doctors, pharmacists, and dentists. Please do have a look, because we have tried to ask, we're not sure if we've covered everybody. Any one of those that had specific information about what's happening for them during the lockdown, we've tried to kind of put the most important information and then a link. And finally, there's quite a lot more on this part. Here there's a stay active page with videos on how to be active at home. But in here, obviously, there's the information about our friendly chat and our listening support group. But that's quite a short information. That one is really important. I'm supposing you might want to have a look at that, because it gives loads of links to wellbeing and emotional health organizations. So that was gathered by the listening support team, that list. That's really nice. Stay safe from abuse, that's information that we shared with you, but again, now it's easy for you to find it. Mindfulness and meditation, there's links to podcasts and apps, and free entertainment. Thank you to Jane as well, and lots of people who kind of added some ideas online of what people can do at home to not be too bored. So there's loads of places you can go and have, you know, tools and all that, and more help. There's information that Anthony's gathered about how we fit within the bigger picture in terms of what are the other organizations involved, what they're doing, which dependent group they're looking after, and what's been happening really. There's also some link to the government website in terms of help for finances. So that's it. Let me stop sharing for the website. Is there any feedback on the website? Any questions? No. Okay, so next point on the agenda, we've got 4 minutes left, so that's going to be really quick. Facebook groups and pages. We're aware that we're not making the best of our Facebook group at the minute, because we've been focusing a lot on the website, so sorry about that. We will now be trying to think about how we can best use those pages to kind of give a clearer idea of what is it that we're doing, how we're doing it. So hopefully things will improve soon, but if you've got any idea on how you think we should be using the Facebook group and the page, let us know. For the update on the parish councils, we've got some news for you. We've got here with us tonight Jane Clark. There she is, she's waving. Jane Clark. She is the clerk of Westfield Parish Council. Westfield has shown an interest in joining the Rye Mutual Aid group, and they're just in border with Breed anyway, and then we had a chat, all of us, at Central Team yesterday, and so we're welcoming Westfield tonight. They're now zone number 21. So after the meeting, we'll go to, we'll discuss with Jane and go through everything and the process and how we work. So welcome, Jane. About the other parish councils, there's not much to say. I need to send them an update with a link to our website so they know what we're doing, and an update about the tracking as well. If I do tracking now, then I can hand over to other people. Actually, if I keep you at the end, Anthony, if you don't mind, then I finish my bit and then you can finish after that. Tracking wise, I'm not going to go through it in detail. We've just been looking at numbers. What it looks like is the numbers are actually decreasing on a weekly basis. What we feel is it's likely that people are now have their systems in place. They've got a slot for a delivery of food, or they've got, you know, an established relationship with their friend, their family, etc. So we've seen the number declining. So if we look at now, compared to 4 weeks ago, we had half the number of requests. We know, like usual, there's a couple of I think places that might not, you know, I'm not sure the tracker are up to date, but apart from that, I think the number are decreasing. Hence why we're now looking at, next point on the agenda, other ideas for RMA. I was contacted by, I don't know if you've seen Andy's studio. I don't know if you hear Andy, with his brother Richard. They went to play some music outside the St. Bartholomew's. And I was contacted by one of the ladies of St. Bartholomew's who helped organize that, saying, how can we cheer up our residents? So we've had a bit of a brainstorm this afternoon, but again, if you've got any idea, I mean, some of the idea we're playing with is have a regular time where they know they're going to be somebody coming outside and playing some music. Some other idea where that potentially it doesn't have to be only music, it could be some sort of entertainment. Also, we could maybe join people with children and they can draw, make some drawings and send them to a specific resident. They've been paired up, so the retirement place can print it and give it to the resident. So any idea you might have to cheer up people, that would be really absolutely lovely if you could share with us, and we can just gather all those ideas and trying to make them happen. There's other mini projects that we have to work on as well. And then last thing for me, I believe, is that we are starting, obviously, discussing with Mary and Anthony, we're aware that it's very likely the situation is going to be an ongoing situation for quite a long time to come. But still, I think there are some people who are really keen to kind of think about the future and think about how we can diversify what we're doing as well. So if you would like to just, again, start thinking about it, start thinking about your involvement, your ideas, and share those, that would be really, really lovely. Yeah, the virtual quiz is a lovely idea. Yeah, that's a brilliant idea. That's something maybe we could propose. It's just for the retired people. I'm not sure. Maybe they could do that inside the retirement places. Yeah. So yes, thank you for that. So now I'm handing over to Anthony for the last part.
4 very quick points, please, Caroline. The first thing is that I've been keeping the various levels of local government fully appraised of what RMA is up to. And also to our MP Sally Ann Hart, although I know that she has her own contacts through Udimore, where she has direct contact with the operation. But anyway, Sally and I speak a couple of times a week, and I've been appraising of what's going on, and also making sure that East Sussex, Rother, Rye Town Council, and other organisations know what's going on. Hastings I'm in touch with, which is the Heart organisation, so that if there is any conflict or overlap, then we can unravel. Secondly, I was talking to Stephen Jemson, as I do most weeks. He says he's still being contacted by elderly people, particularly in little isolated clumps of houses around Peasmarsh on the East Sussex-Kent border, who don't seem to know what's going on. So if you're in villages on that sort of peripheral area of Ryan District, perhaps you just give a thought as to whether there are little isolated clumps of houses where people are isolated and haven't actually fully twigged as to what support is available. Third point is the food bank. That's the Rye Food Bank. I'm in regular contact with Chris Emson. She has quite a lot of resource now at her fingertips. The beneficiaries are rising dramatically. They've gone up sort of fourfold in the time of this crisis. And we've been talking and helping with both resource, with deliveries and other things. I know that people like Nikki Stewart and others have been involved. So if you hear anything about food bank, people having trouble getting to the food bank or benefiting from it, do feed it back in, and we can talk to Chris and then unravel. But there's no excuse for anybody falling down between the crevices. And finally, as Caroline identified, on the front page, it's a little bit concealed. There's a tiny here button, but it explains all the other organisations that are now up and running, and you may come across them. NHS Army of Volunteers, the people who are looking after the shielded list patients of the NHS, those with serious concerns. The Rother community support group, many of you will have had letters from Rother explaining that, and East Sussex, who are also running community hubs. So there's quite a lot now going on, and I imagine that some of those organisations are probably taking up some of the early beneficiaries from Rye Mutual Aid, which was really first out of the blocks. So that's all I have. Thanks.
So is there any question that we've missed, Bruni? Because I know that you've been following the chat, and I know that you've kind of mentioned another question that was from above, and I can't find it. Is there any question?
Actually, there was a question very, very early on, which was a question from Beckley. They were just wondering how they can track if they've if they've sent someone over to the listening support protocol. How do they know if that is answered? We don't know.
We don't. I think there was a discussion with the listening support team that the only tracking you do is you actually write down on your tracking that you have passed on that request, and you write down the name to the person you talk to. Mm-hmm. Obviously, the people on those 5 dispatchers from the support take over from there, and they've got their own tracking. They've got their own tracking mechanism. I'm not sure if Jen was working on that. I'm pretty sure it's happening already, hopefully. But yeah, they have got their own tracking sheet because it's much more vulnerable group as well, and then and it might be an ongoing things after that. So we felt instead of you having to be depending, you just kind of get the request, pass it on your tracker, record it as passed on to this person from the listening support team, and then that you've done your bit.
So is that kind of, you can tick that I've done my bit, I don't need to necessarily worry about that person anymore?
No, the listening support will, because they got 40 people on their team. They're a big team, and they got 5 dispatchers, 5 main, they call it the inner circle, and then they can then take over.
Okay, and then I think there was just a question about whether if people make any amends to the trackers, are they then linked in any other way, Caroline, to a system, or do you go into each tracker and then?
I go into each tracker.
Okay, fine.
and then I kind of collate the information. Yeah, there's something else I wanted to say about that, and I forgot. Is yes, we've had some feedback that people might not quite understand why we are doing the tracking, and it's definitely not about competing between zones, because we've got different demographic, different needs, it's nothing like that, but it's very much we're working with Anthony on potentially making it even more structured. So far the only thing we've done was trying to track the request, because we wanted to have a look to see if there's any zone that we're going to be swamped while others were not, and if we could reallocate resources. So because we've separated in zone, but it's just, we all part of Rye and community and local area, so we could all help each other. A second thought initially was that if the pandemic becomes, high rate in our local area, the authorities will want to follow it closely, and in particular because we're helping many of the vulnerable and the shielded. So we thought that at that point we could then pass on that information and just say, this is the level of request we're getting, this is the increase compared to last week or the week before, in case they have to react and adapt their own actions. So Anjan, you want to say a bit more about what we could do with that?
Sorry, I was just I was just on the chat. Sorry, I missed the last bit.
No, just saying that we are thinking of formalizing and using the tracking information as part of a more general, maybe
Yes, yes,
bi-monthly report to authorities.
Yeah, I think it's important that every couple of weeks we sort of make 3 points up to local authorities, to the MP, just as a sort of roundup, without getting involved in detailed data and other issues which are sensitive. And so I've been talking to Caroline saying that we ought to put that together as the central team and just fire that up. Partly it will let other people know what's going on, but also the people I speak to will welcome it because they're always looking for information on what's going on in the nether regions of East Sussex. So yeah, we will pursue that, certainly.
No, apart from that, I think a general word is what, I mean, you will have seen on the website we're doing a brilliant job. The feedback, I keep on receiving really positive feedback from residents straight to just thank us for what we're doing. I think we are doing what we set out to do, which is, help with the immediate needs of our, vulnerable and shielded people during this time. If you have, and if you feel that you have, you've got an other box under the type of requests, and you feel that you are getting requests that you'd like us to consider more generally to make sure that maybe we mention them, because we say on the website that we're happy to receive any request, and for any request we will be considering them. But maybe if you see anything like that, just please don't hesitate to just bring it up to us, and then we'll see if we can share the best practice with the rest of the zones. Yeah, just a big thank you for everybody who helped with the letters, and hopefully if there's anything that you feel that we should add on the website or anything else, please come to us and we can chat.
Anthony, sorry, when you said to sort of make sure there's no gaps or villages or sort of small clusters, what do we do? So we've got our sort of central area, for example, but if you looked at maybe Jury's Gap, which I've just learned sorry, don't know that side, or if you were my side and maybe you go up to Cripps Corner, Staple Cross, where does our jurisdiction end, and how do we then check that they are covered? Should we just keep going, I suppose? How do we know when to stop?
I think keep going within reason. You're an unconstituted body, and as Mary repeatedly tells us, she's not too fussed about boundaries. So I think if you identify an isolated outcrop of 3 or 4 houses, and there are lots of these little groups, I mean, Jury's Gap right in East Camber is an example. Whether it's in Kent, whether it's in East Sussex, I wouldn't be exactly. The key is it which side of the Kent ditch is it? It's probably on the Rother side. But if you identify an area like that, then I think you just press on, because clearly they're not being serviced by adjacent organisations, community support organisations. There's not a lot going on immediately beyond us until you get round to Hastings and towards Bexhill Way. So, but if there's a problem, do contact me and I will speak to the relevant authority, whether it be in Kent or in East Sussex, and just make sure that that you're not treading on any parish's toes.
Yes, Paul, if you want to unmute yourself, can we, or I will take it that with Paul. Yes, Winchelsea had an issue tonight. I really could not understand your tracker. So you were one of my 2 that I wanted to contact afterwards to say, oh, I don't know actually what's happening. I'll have a chat with you, Paul, later on. Is anybody else got any question or any idea, anything they want to share at this point? Or should we?
If anyone has anything else, please feel free to email me. It's lovely. I'm getting emails all the time, which is really nice. I know there's a couple I haven't replied to, and I'm sorry. And sometimes I'm linking different people to different groups or neighbouring areas. But please, just anytime you've got anything that you need, I can't answer everything, but I can often find out someone who might know. Then please just let me know anytime. Honestly, it's fine.
Yeah, and two things coming your way is going to be giving us idea for entertaining and you know, distract like the residents, the masks initiative, and if you got anything that you feel should be on our Facebook and social media or website, just keep in touch. So apart from that, a big thank you from us.
Can I just make one very final point, Caroline? You mentioned from your statistics that the tasking was about 1 task per 6 or 8 volunteers. So it is more important now to make sure that all the volunteers are doing something. Otherwise you will lose them, or they'll go off and do something else. So do spread the tasks about, and we'll just see whether the tasks pick up. We've no idea how this thing's going to go, but it will go for a lot longer than I think a lot of people are assuming at the moment.
Yeah, and then if you got any more idea of like mini project, like we call them, like, you know, the idea of the entertaining and the music, or the pairing up children with elderly people, and any other things that you think you could involve your volunteer in, and that would be a nice thing to do for our community, just let us know. Yeah, and I think, yeah, that's it for us. And I think we're just going to stay behind with Jane from Westfield now and have a chat. So have a lovely evening, everybody.
Yeah.
And we talk to you soon. Thank you for joining. Thank you.